Hello, everyone. Welcome to Morning Rounds with Dr. Ruddy. Sorry for the background. There's been some kind of reception problem in the other room, so I've had to relocate to this dark spot of my home. But hopefully, you can hear me and see me. And the most important thing is that you understand the message. And so here's the message for today. It has to do with what cancer does when it moves into the bone. So there are 41,000 women who die of breast cancer in the United States every year. In fact, somewhere in the world, a woman dies of breast cancer every minute. These women have stage 4 breast cancer. That is, the cancer has moved from their breast to other parts of their body. 75% of the time, among other tissues, the breast cancer has moved into the bone. And when breast cancer cells, in fact, when any cancer cells move into the bone and set up shop there, they eat away at the bone. They actually destroy it. They make holes in the bone. Patients complain of pain. A very good form of therapy is radiation therapy that reduces the pain. It doesn't prevent the cancer from spreading, but it controls the symptoms. And as you know, I had a patient, the first patient I presented to you, who said to me when her cancer had recurred in the bone many, many years after she was treated, she said, the cancer was in my breast, the cancer was not in me. So she was treated with a special drug, and in fact, she did so well over a period of really several months that the medical oncologist has taken her off that medication, and she is doing very well, and she has no symptoms. So we're very optimistic for her. Back to the issue of what cancer does when it gets to the bone. It eats away at it, creates these holes, and in fact, the process is very similar to the process that we see in women and in men who have osteoporosis. So the process is very much the same. Scientists around the world, and particularly in Utah recently, are developing drugs that can inhibit that process. But I invite you to do some of your own due diligence and research on a vitamin that has been discovered just recently, relatively recently, to be extremely powerful in reversing osteoporosis and preventing that kind of a degradation of the skeleton. It's not been tested in patients with cancer, but overall it's very good, and I think it's worth some study and investigation on your part. The vitamin is called vitamin K2. The subset of the vitamin is 7, so it's K27. To learn more about this, I'll give you a link below to a very good, thorough information video on the benefits of vitamin K2, the power that this vitamin has to prevent osteoporosis, and oh, by the way, help reverse and prevent heart disease, because what vitamin K2 does, it acts as a kind of catcher's mitt, and it catches the calcium that you absorb in your body, and it then, like, a very good catcher, right? Think of your favorite catcher, sends that sends that calcium into the bone. And in the meantime, it takes the calcium that might be lining the vessels of your arteries. These are the kinds of plaques that are associated with atherosclerosis and heart disease. Takes the calcium out of those places where it is not needed and is not the least bit useful, and it puts it into bone as well. So there's really nothing not to love about vitamin K2 now that we know its existence. The problem is that vitamin K2 naturally occurs in grass. Well, we don't eat grass, but in days gone by, we ate animals and dairy products that had fed on grass. So the cows ate the grass, and the chickens ate the grass, and the eggs that we ate, and the meat, and the dairy, and the milk, and the cheese contained vitamin K2. Well, in the past 60 years or so, the whole food chain has been modified so that our animals are fed grain and not grass. So the majority of people here in the United States, in fact around the world, are deficient in vitamin K2. And this may explain a lot about the epidemic of osteoporosis and the epidemic of atherosclerosis, and who knows what benefits might be accrued to improving our dietary intake of vitamin K2 for the purposes of preventing, perhaps even treating, patients whose cancer has gone to their bone. So I'll give you the link. Thumbs up to you, thumbs down to breast cancer and all the other cancers as well. If you have any questions or you'd like to get in touch with me, by all means, leave your information in the comments below and I'll be happy to address them. Have a great weekend. Thank you.